Hello, I'm Dr. Brandt Gibson, and today we're going to talk to you about another form of nerve damage. The nerve damage that happens because of compression neuropathy. With compression neuropathy, there is either a bone or a anatomic structure that's putting pressure on the nerve and causing compression of that nerve, which causes it to malfunction or to not function like it's supposed to and will cause peripheral neuropathy. The most common compression type neuropathy that people have heard of is carpal tunnel in the wrist. There is a similar compression neuropathy down the ankles called tarsal tunnel, and it can similarly cause symptoms that are very uncomfortable and can cause peripheral neuropathy. Another common presentation in the foot would be a neuroma. A neuroma is a type of compression neuropathy where the nerve itself is getting compressed and a lot of times will get inflamed and significantly painful. So with compression neuropathy, there's a couple different things you need to do. One, you need to find out the cause. You need to look for what's causing this compression neuropathy, what's interfering or injuring the nerve in this case. Typically, this can be done through x-ray, both ankle and foot x-rays, for example, to evaluate how the nerves are flowing into the foot. The other is to do ultrasound because you can see soft tissues that you can't see on x-ray. The advantage of the ultrasound is you can see soft tissues including blood vessels. So if you have, say, a varicose veins that are crossing and pressing on that nerve, that in and of itself will cause a peripheral neuropathy or pain down into the foot that can be pretty uncomfortable and pretty problematic. The problem with compression neuropathy is there is not a lot of medical or other conservative type treatments that can alleviate a compression neuropathy. Typically with a compression neuropathy, you will require surgery. Thus, you hear constantly about carpal tunnel surgeries for individuals that the pain is just not going away. Once they get the surgery, however, this neuropathy will improve significantly and often get back to normal. So as opposed to many of the other types of peripheral neuropathy, if you treat the compression neuropathy, most of the time that is all you need to do and you will get improvement and you get relief. And so typically that's all we will end up doing. So compression neuropathy is a type of pressure on the nerve that causes it to either be inflamed or to malfunction in some other way and cause significant discomfort. Surgical repair is the only option, but usually is very effective at limiting or completely eliminating the nerve damage. So you can control the nerve damage by eliminating the pressure. So you don't have any compression left. You no longer have a peripheral neuropathy. You no longer have the nerve damage, and you can get back to normal life, or as we have said in the past, you can start having your extraordinary life without the discomfort and disability that comes with a compression type neuropathy.